Hey guys, so I haven't made a video in a very long time, and that's both because I've been very tired lately and I've also been very busy with school and my schoolwork. Um, but I've gotten a lot of questions recently on my lupus treatment, especially the Rituximab. I know a lot of people take it for several different reasons, not just for lupus, and I've gotten a lot of direct messages on Instagram and elsewhere about how the Rituximab makes me feel and if it's worked well for me. So I just wanted to give you all a little insight on that. And so basically I started getting Rituximab, let's see, I want to say it's been about a year and a half or 2 years ago that I got my first infusion. And I always get 1 gram of Rituximab, and then in 2 weeks I get another gram. And then they wait around 6 months to give me my next dose. At first, it didn't start out every 6 months. I started out doing it every like 2 months or 3 months. And then as I got better, they started spacing it out more because I was doing better, and it's not necessary for me to get that much Rituximab. So yeah, they started spacing it out. Also, a lot of you may know the drug as Rituxan, not Rituximab. So just a heads up, it is the same thing. Yeah, the main questions that I got was, one, how does it make you feel? Everyone is different. I have to say that. I know a friend that gets Rituximab as well that doesn't report the same feelings that I do. And so my aunt, she also gets Rituximab, and she also feels very different than I do. So everyone is different. Don't take my word for it. Your experience is probably going to be different than mine. But I'll go ahead and tell you what I feel, just so you can get kind of like a rough idea of what's going to happen. So when you're getting it, it doesn't hurt. It's not painful in your IV. Pretty much, if you don't get an allergic reaction to it, which is great, then it's just a regular infusion, much like chemo, which Rituximab pretty much is chemo. It's a chemotherapy drug. It is considered that because a chemotherapy nurse has to give it. So just putting that out there. I know it's not technically chemo, but it is considered a chemotherapy drug. So basically, yeah, you just feel it the same way you would chemo. And for me, the side effects start maybe hours into the infusion. I start getting really bad pain in my legs, usually, and in my arms. And it's muscular pain, and it's very, very intense. Most of the time, I'll cry, I'll scream because I'm in so much pain. But the pain goes away shortly after. The pain only lasts about a day, and it goes away, and I don't feel it anymore. The only thing that I do feel afterwards is I feel tired. I feel like I just want to sleep for a long time, and it kind of like knocks me out. And I usually sleep for a few hours after the infusion is done, and then I'm good to go. Okay, And then the other question that I have also been asked is how long does it take to work? And that, it really depends on what you have. But for lupus patients, usually it takes about 2 weeks to start working or for you to start seeing any differences. So the first thing you'll start seeing a difference in is your labs. Whether it be like immunosuppression, like your platelets go down or things like that happen. But also for me, my kidney function will start regulating itself. So for me, the biggest thing is that I spill a lot of protein in my urine. And so it's usually 3 plus, but when I get my rituximab, it's around 1. So it goes down a lot. Um, you know, I see a significant change in my labs about 2 weeks afterwards, my first infusion. And then also what I get with my lupus is a lot of pain. And so when I don't have my infusion or I haven't gotten my infusion in a long time, I start to get more generalized pain all over my body, and that starts to go away. That's the last thing to go away. So just be mindful of that. If you do get pain with your disease, whatever it is, that's usually the last thing to go away. So be patient. It takes maybe, I want to say 6 weeks for it to start going away and for you to start seeing a difference. So yeah. What else? I guess that's pretty much it on the rituximab or Rituxan, whatever you want to call it. Oh, one other thing. I do get pre-medication with my rituximab. I get hydrocortisone, I get Benadryl, and I get pain medicine right before my infusion and also before I get hydrated. So they have to do 4 hours or 4 or 6 hours of hydration. I don't really remember. So I do get the Rituxan as an inpatient rather than outpatient. I know a lot of people get it as an outpatient, but I get it inpatient. And I do get those pre-medications. So I'm guessing most of you do get those pre-medications, but if you don't, you should probably ask about it. Just because rituximab has the tendency to make a lot of people get really bad allergic reactions. I know a friend who his lungs collapsed when he was getting a rituximab infusion, and now he has to be monitored more closely when he gets his infusions because he could possibly have that happen to him again. And so, yeah, just if you're not getting any pre-medications, I mean, that's a good sign because that means that you're probably not allergic to it in any way. But just ask your doctor about it, and ask them if maybe you should be getting pre-medications, just as a prevention. So yeah, that's pretty much it. If y'all have any more questions, go ahead and DM me on my Instagram, or send me a Facebook message. I have a Facebook page as well, which I will post my link to, or not my link, I'll just post my whatever on the video. But anyways, yeah, that's pretty much it. Send me any questions you might have about this or about anything. Yeah, that's all. So, bye.